Hi everyone, this is Dr. Daniel Sugai, board certified dermatologist. Thank you for staying home and staying safe during this time. I just wanted to do a video today on different skincare problems that can arise while staying at home. So stay tuned for these tips. Self-made bakers, chefs cooking up different delicious meals I love seeing on Instagram. We're seeing people being barbers because we're getting the pandemic hairdo and we don't have our barbers to go to cut our hair. So we're seeing people in the kitchen quite a bit and they're getting burned. So when you have hot oil splash onto you, you can develop blisters. And when it gets to that point, it is considered a second-degree burn when it starts to make a blister. And those have a risk of scarring, okay? So when you have a blister, the big thing that I want to tell you is that don't pop it. Don't pop it yourself, all right? Because the worst thing you can do is pop it and then unroof the blister, and you have an exposed wound or erosion. We don't want that, because when we have a blister, you have this roof over the top. What you want to do is conserve that upper layer that's the roof of the blister, so that when the blister does absorb and sinks down flat, that top roof becomes a biologic band-aid. Okay, so you have your own natural band-aid to protect the wound that's below. Okay, so if you have really big blisters that are very painful, I have had patients come to see me and I will unroof it a certain way and I will clean it very well. I'll unroof it and then we'll talk about the skincare afterwards. But for this video, I just want to let you know that if you have these little blisters from taking stuff out of the oven, I call it the Sugai sign, when you have this linear mark on your wrist from taking things out of the oven and you'll burn yourself on the rack. That's one thing. And then the other thing is, if you're getting hot oil splashing on you, causing a blister, a whole line of blisters, that you definitely want to avoid popping. And what I would say for at home is, if you have Aquaphor, Vaseline, just a gentle soothing ointment, Vanni Ply is another nice thing you could put over the blisters, and then cover it with a nonstick gauze and tape, so that things don't traumatize it and rip the top layer or the roof off. We want to conserve that roof as much as possible, so you want to protect that area. Okay, so that's for blisters. If you do have mupirocin, which is a great prescription medicine that you would have to see me to get, that is nice to have on hand. And I always make sure I have a tube of mupirocin ready to go in case something happens. Another issue that we're seeing with people at home, they're doing yard work, you're getting foreign bodies stuck into your finger. And that's something we see all the time, even before the pandemic, people getting thorns and dirt or rocks stuck in your finger when you're active outside. I have a picture of my finger when I did yard work the other day. I woke up and my finger was red hot, swollen, and it had this little black dot in it. And thankfully, because I'm a dermatologist, I was able to disinfect the area, use the proper tools to extract the foreign body, and as you can see, my finger is much better today. So just yesterday I had to extract it. Today, much better. The swelling's gone. I didn't need any oral antibiotics. But things I like to disinfect a wound would be betadine. If you do have a wound, you want to use betadine or iodine if you're not allergic to iodine. So if you have an allergy to iodine, obviously stay away from that. So to clean things, there's rubbing alcohol, which is very scarce at the drugstore because people are grabbing alcohol because Purell and hand sanitizers are not available. So alcohol is hard to find. Iodine is very expensive nowadays. The other thing you could consider would be chlorhexidine or Hibiclens, is another over-the-counter cleanser that you could use, but avoid getting it in your eyes or in your ears because it's toxic for those areas. But the thing, if you have a big wound, you want to avoid using alcohol or hydrogen peroxide. Yes, those will disinfect a wound, but you don't want to use that on a daily basis to clean your wound, because what it does is it will damage the new epithelial cells that are trying to come in to heal that wound. So what I rather do is do iodine as a way to help clean the wound, or just regular, soap and water, and just letting water and soap run over the area. Don't scrub. And then after you're done with that, you put a nice layer of Vaseline or Aquaphor over the wound. I tell patients to avoid using bacitracin, Neosporin. Those over-the-counter antibacterial creams have a tendency to cause allergic contact dermatitis, which I see a lot. So when I was a resident at Harvard, I would have the call pager and I would get called in the middle of the night from the emergency department to go into Mass General and take a look at this bizarre infection that has been plaguing this patient for weeks, has been on multiple antibiotics and IV antibiotics even. And I will ask them first, any bacitracin or Neosporin use? And if they say yes, I will know just by the look of it and by the history that it's most likely from an allergic contact dermatitis. So I really dislike it. I wish they would pull it from the shelves, but in a pinch, maybe you do need it to help heal a bacterial infection at home and you don't have access to a doctor. You could try that, but with continued use or just a couple of times, you could develop a very severe rash. But going back to foreign bodies, I'm lucky that I'm able to do it safely. If you do see a visible thorn or something coming up above the surface, you could do it like how my dad would do it, get a tweezer and pluck it out, and then you're good to go. But if you have something lodged deep in there, you definitely want to see a physician to help get that out safely. There's also the article that came out the other day that said that people at home are starting to remove skin tags and moles at home by themselves. So another DIY no. Do not do that at home. You need to see a doctor to get those safely removed. Skin tags, to make a tag, you have a trunk of blood vessels in the tag. And if you were to cut it with your own scissors, not only are you at risk for infection afterwards, but you're also at risk for just bleeding. That trunk of blood vessels hidden within the tag stalk, if you cut that, it will pump blood and you're gonna be stuck with a bleeding wound. So you're gonna probably end up seeing a doctor to get it cauterized anyway. So definitely wait on those things until after the ban is lifted and you're able to go see a doctor. Moles too. I'm hearing patients using apple cider vinegar or these, skin tag removal kits they're buying online. Please don't use those. I'm seeing patients with chemical burns from those things that can lead to permanent scarring. So big no-no on that. Another thing that we're seeing is that people are cutting their hair at home. Is an area that does bleed quite a bit. So when I tell my patients who have had issues with bleeding because they're on aspirin or on Coumadin or some kind of anticoagulation therapy to thin out their blood, and they get a wound or they had a procedure done and they're having some post-op bleeding, what you want to do is put direct pressure over the wound for at least 15 minutes without peaking. You don't want to be putting pressure, peak, and doing that over and over, because you're not going to get the clotting you want and it will keep pumping blood or keep oozing. All right, so what you want is continued direct pressure for at least 15 minutes, and then you can check and see what's going on with the wound. If it's bleeding again, do it again, cover it. And if that doesn't work, then you have to see a doctor, obviously, to get it to achieve hemostasis with either aluminum chloride or even cauterize or electrodesiccate the wound. So you go from the side here so that it lays down flat. See that? You want it to be like that.
What happens if you went
from above? So you don't want to just to lay down flat like a. This all sounds very scary, that all these things that can happen at home, these accidents. I hope you all stay safe at home, be responsible, continue to bake and make those delicious meals and keep posting them on Instagram, because I love seeing them. But be safe when handling oil, the oven. Also, good to see everyone getting their haircuts at home, but please be careful with the scissors. And also when you're doing yard work, try not to get things lodged into your finger. But I am still seeing patients on an urgent basis. So if you have an issue and you're local, please let us know and we can try to fit you in to help you out, okay? But otherwise, stay safe, be healthy, stay home, take care.